If a dentist told me I wasn't a candidate for implants, I'd know exactly what to do next. And the first step isn't what most people do. I'm Dr. Madanese, an implant surgeon who spent the last decade doing nothing but full arch reconstruction. And after watching more than 2,000 patients go through this, the ones with the best results all had one thing in common. We're going to cover what most people do first and why it costs them months, and what I do instead, and what you can do tonight to get started. When most people are told they're not a candidate, the first thing they do is find another dentist and get a second opinion. They book an appointment nearby, describe their situation, and wait for a different answer. That feels like the right move. One verdict felt wrong, so you go find another one. A second opinion is standard advice for any big medical decision. Nobody tells you to be careful about where you get that second opinion or what kind of practice can actually give one that means something. A second opinion from a general dentist gives you a data point from the same level of training as the first. The bone the first practice couldn't assess is just as hidden from the second. You're getting the same answer from a different person. The standard dental referral system doesn't send you to someone who looks at this differently. That's why right first move is hard to find. Most patients, after one unhelpful second opinion, either start looking at denture options or start managing each failing tooth as it becomes a problem. They put a bridge where a tooth came out. They get a partial plate. They keep going back for more pulls as things get worse. That feels like doing something. Every dollar spent managing failing teeth before a full exam is money spent on the wrong problem. And every tooth pulled without a plan for what comes next speeds up bone loss at that spot. Patients who spend 2 or 3 years in a pattern before getting the right exam almost always start from a harder place than they would have. I'd call a practice that does full arch work as its main focus. Ask to be seen by the surgeon and ask how many full arch cases that surgeon has done before I booked anything. The patients who started there told me the first call sounded nothing like any dental consult they'd had before. If this gives you a clearer picture, subscribe before you keep going. Every video in the series is built for the patient who's trying to navigate the system without a guide. How to know which version of this applies to you? Was the imaging in your most recent exam a flat X-ray, or was it a cone beam CT that gave a full 3D picture of your jaw? Was the person who gave you the verdict a general dentist, or a surgeon whose whole practice is built around full arch work? Since you got the verdict, have you had more teeth pulled, or is your bone roughly the same as when you were seen? If your first exam was based on a flat X-ray by a general dentist, your bone has never been looked at for surgical planning. Start at the beginning. If you've had more teeth pulled since the verdict, the starting point is the same, but the clock is now moving faster because bone loss adds up quickly after a tooth is pulled. If your exam includes a cone beam CT by a surgeon who does a lot of full arch work and they still said no, the situation calls for a different kind of talk. You'd want to know the exact reason before you decide what to do next. If I were in your position, I wouldn't spend another dollar on any dental work until I had a proper full arch exam. That means a cone beam CT reviewed by a surgeon who does this as their main focus, with a digital plan mapped out before any verdict is given. Every dollar you spend before that exam is going towards the wrong problem. A bridge to replace a missing tooth costs real money. It may not matter at all if a full arch plan turns out to be the right path. A partial plate manages the surface and does nothing for the bone underneath. The exam changes every decision that comes after it. Do it first, and everything else becomes more clear. The patients who come to us after 2 or 3 years of managing individual teeth tell us the same thing every time. They did what felt right. By the time we ran the cone beam CT, the picture was different from what either of us expected. Sometimes easier to work with than the original verdict suggested. Sometimes harder than it would have been if they'd come in sooner. In every case, the scan changed what we were working with. If you have teeth booked for an extraction at a general practice, stop until you've had this exam. Pulling teeth at another practice before a full arch plan is in place makes the planning harder. If the exam shows a full arch makes sense, some of those extractions may be part of the process and handled differently. If it points to a different path, you may not need them at all. Find a practice that does full arch work as their main focus. Call them. Ask 3 things. How many full arch cases has a surgeon personally done? Did they use a cone beam CT and a digital plan before they give any verdict? And is the manufacturing done on site or sent out? Write down the answers. Those 3 questions tell whether you are talking to the right place before you spend $1. Most patients get a not a candidate verdict, spend a few weeks looking things up with no clear place to start. Tonight's test gives you one specific first step that costs nothing and tells you more than hours of searching. Tonight, do this. Step 1. Search for practices in your area that focus on full arch implants. Look for practices that use cone beam imaging, digital plans, and make teeth in-house. A practice that lists full arch as one of 20 things it offers is a different kind of place for one that built its whole model around it. Step 2. Call or email or text one of these practices tomorrow and ask 3 things. How many full arch cases has your surgeon done start to finish? Do you use cone beam CT and a digital plan before you give any verdict? And is the manufacturing done on site or sent out? Step 3. Write down the answers. A surgeon with thousands of full arch cases, working from 3D scans, and an in-house setup gives you a completely different kind of exam than one you've already had. The verdict from that conversation may not match the one you've been carrying. Step 4. If you have teeth booked for an extraction at a general practice, call and ask whether those can be pushed back 2 or 3 weeks without causing pain or infection. If they can, wait until after the full arch exam. If a dentist told me I wasn't a candidate, the last thing I do is treat that as the final word from someone who may not have the tools or the expertise to give me a complete exam. The first thing I do is find a surgeon who does this every day and ask them to look. You deserve to hear that answer from someone who's actually qualified to give it. If you want to understand what a real exam for this procedure actually looks like and why it's different from what most patients receive, there's a video on this channel called My 94-Year-Old Grandfather Had No Bone Left, and I Still Gave Him Permanent Teeth. It covers the 5 parts of a real exam and the specific questions to bring to your next appointment. The link is on the screen now.